Guys, with the basic knowledge on what exactly is a receptor and what are the types of the receptor, now we're going to the next important part, that is the interaction between a receptor and a drug molecule. Consider we have a receptor and we have the drug molecule. In what way it is going to be interacting, how it is going to be producing the response, that's what we're going to talk about right now. Receptor and drug interaction. How are we going to explain it? We're going to explain it with two different terminologies. The first one is called as affinity and the next one is called as intrinsic activity. Consider we have a receptor and the drug is going to bind with it. In what way it is binding? Is it forming a weak ionic bond? Or is it forming a weak van der Waals forces, like it is going to form a weak bond? Or is it forming a strong bond like a covalent bond? Based on that affinity, this drug is going to be producing certain alterations in the receptor. That binding will be called as affinity. Simply in your books, a beautiful term would have been given, the strength of association between the receptor and a drug, that will be explained as an affinity. The next one is intrinsic activity. Consider we have the receptor and we have the drug molecule. The drug molecule is binding with the receptor and this receptor is there on the surface of a particular, for example, I'm saying it is going to be there on a muscle. What is going to happen to that muscle? Is the muscle going to be contracted or is it going to be relaxed? What's the maximum effect which can be seen? That will be termed as intrinsic activity, or IA. So the maximal effect which can be observed because of binding of a receptor and drug, that will be termed as intrinsic activity. Based on these two different terminologies, we are going to classify the interaction between a drug and a receptor into four major classes. The first one is called as an agonistic agent. As we can see in this table which has been displayed, we have agonist, we have partial agonistic agents, we have antagonistic agent, and we have inverse agonistic agent. Agonist or full agonist, partial agonist, antagonist, and inverse agonist. Simply put, consider here is where the muscle is. We have a muscle over here and on the surface of a muscle is where a receptor is. We have a physiological, a classical neurotransmitter, a physiological neurotransmitter. It just comes and sits over the receptor. Consider here is where a muscle is, right? On the surface of a muscle is where a receptor is, clear? And if I give a particular drug and that drug molecule is going to bind with the receptor, or if I give a neurotransmitter or physiological neurotransmitter, that also is going to be binding with the receptor. Here let's talk about a physiological neurotransmitter that is binding with the receptor, and because of it, it is going to be producing contraction of the whole muscle. The whole muscle is going to be 100% contracted. Just for an example I'm saying. Now forget about this. Again we have the muscle. We have the receptor on the surface. Now you don't give a physiological neurotransmitter. Here you administer a drug molecule which is structurally very similar to that physiological neurotransmitter. Drug means it's a xenobiotic agent. And that drug molecule will go on, is going to be binding with the receptor, and because of it, if it is producing the same 100% contraction of the muscle which is producing a response which is similar to your physiological neurotransmitter, then this molecule will be called as a full agonistic agent. Now let's talk about the next one, partial agonistic agent, right? Again we have the muscle and we have the receptor here. If I have a partial agonistic agent which is coming and binding with the receptor, there is not going to be 100% contraction, there is just going to be a smaller level of contraction. It is not going to be 0, it's not going to be 100, it's going to be in between, like 60% or 70% of the responses. This will be termed as partial agonistic agent. What if it is an antagonistic agent? Clear? Again, we have the muscle over here, muscular cell. On the surface, we have the receptor. Now we have an antagonistic agent. It is coming and binding with the receptor. What will happen to the muscle, guys? Relax? No, it will not produce relaxation. It will also not produce contraction. It will remain as such, right? Then what is actually the function of an antagonistic agent? If it is not producing any response, why are we giving that drug? See, here it is not producing a response. At the same time, it is preventing the physiological neurotransmitter from binding. Is that clear? Antagonistic agents are preventing the physiological neurotransmitter from binding with the receptor, and that's what the major function of an antagonistic agent is. Is that clear? Moving on to the last one, inverse agonistic agent. Again we have a cell, we have a receptor, now we have an inverse agonistic agent. This inverse agonistic agent is coming and binding with the receptor. Now what will happen to the muscle, guys? Now it's an inverse process. The muscle is going to get relaxed. The opposite action tend to occur. That's why it is called as an inverse agonistic agent. Now let's come.